Hello, my name is Shannon Maixner and I'm a physical therapist, and I also do muscle activation techniques. And I got to say, I'm so excited about the muscle activation techniques. I've been a physical therapist for 32 years, but now started muscle activation techniques a little over 15 years ago. And there is such a difference with the muscle activation techniques because I can identify exactly which muscle is not firing, and based on doing evaluation, and I see where you're limited in range of motion. And it used to be that we would stretch, and that was a pillar of physical therapy, but I no longer give stretching. Instead, I try to figure out which muscle isn't working, test them, and then I treat it. There's a palpation technique, and then I can give the patient some exercises for home, and they can continue these on their own because we want to change. It's the neurological system that is really not working, and so it's neuromuscular. So if we can get those two talking together, it's like putting the battery cables back on nice and tight. So that's what we're looking for, and it's so fun as a physical therapist and MAT practitioner to see that and see the changes in people and see them be able to do the things they love. So often people come in and they have pain, and they're like, what can you do for me? And it's really fun for me because there's a lot of things we can do, but I start off with just checking the range of motion, seeing where they're limited, because their body is going to tell me where I need to work. There's no second guessing. And oftentimes what's confusing to the client or the patient is that it's not where they have the pain, but it's where their body tells me to go. So I don't have to guess anymore. And so as we get more muscles on, because with muscle activation techniques and physical therapy, we will actually get the muscles recruited. And so there are thousands of muscle fibers in every muscle. So let's say there's 650,000 muscle fibers in a bicep. I want to recruit more. And the more that I recruit it, the easier it is. And when those muscles are recruited, it actually puts a stimulus or decreases the pain receptors. So the pain receptors no longer are telling the body and the brain that I should hurt. Instead, they're starting to feel the muscles come on, and they no longer even feel that pain. And we can do that in one session. So it's pretty amazing. I see it day after day. That's why I'm still so excited about what I do after 30-some years. So when you come for treatment, we'll actually see you before and after that you have the procedure. And the reason why we have you come before is for us to evaluate and help have Dr. Hansen really figure out where he wants to work, and we all put our input in, which is really neat, this collaborative effort that we have. And so we'll look at that, and then my whole goal is try to get the mechanics restored before Dr. Hansen does his amazing work, because then we're getting the right stimulus to the ligaments, to the muscles, and to the tissues. And that's so valuable to get it right off the bat. So, I really encourage people to come in for a couple visits before they have the procedure, and then after, because there is inflammation after you've had the procedure. And so then we can just work on those muscles again and get things moving like it should, so then you can have the right stimulus to the tissues that have been treated. So I get asked a lot, what's the difference between physical therapy and muscle activation techniques? Muscle activation techniques is different in the fact that we can isolate the muscles in each specific muscle rather than a group of muscles. So I can identify exactly what muscle isn't working and get that fired up with the nervous system, and we do it that day. And so when they leave from that treatment, not only do they have increased range of motion, decreased pain, functioning better, usually they're telling me, I haven't felt this good in how long? And versus in physical therapy, when I'd see people, I would see people 2 to 3 times a week for 6 weeks, and then we'd be saying, do you feel any different? Is there any improvement? So what happens then is these people get so excited and motivated about the changes in that one day that they're like, what should I do, Shannon? And they're going to follow through with their program. They get excited. If they leave and they go to another part of the country, I am connected all over the world, actually, that we actually have a system that other people are doing similar things, muscle activation techniques. I can contact them and get them connected with people wherever they are.